Are you thinking of using Qsymia as a weight loss medication? Hi guys, I'm Dr. Kidd, a board-certified family medicine physician who's helped thousands of patients with weight loss. And in this video, I'm going to give you all the key information you need to know before starting this medication, including how much weight loss the average person expects when using this medication, and how it compares to other popular weight loss medications such as Ozempic. So what is Qsymia? Well, it's a combination of two medications that suppress appetite, Phentermine and Topiramate. The Phentermine component is traditionally a weight loss medication and is typically used as a solo agent. It actually does have a similar chemical structure to amphetamine and can have similar side effects as the stimulants, such as headache, dry mouth, and effect on sleep. However, it does not tend to have the addiction potential. The Topiramate component was traditionally an anti-seizure medication, and with ongoing clinical use, doctors found that it actually helped a little bit with weight loss. It's typically not used as a solo agent for weight loss, but when added to Phentermine, can enhance it by giving a dual action for weight loss. So how do you take it? Well, Qsymia comes in 4 dosage forms that are taken orally once a day. These are the 4 doses, the lowest dose being the 3.75/23 milligram dose, all the way up to the 15/92 milligram dose. The recommended way to start the medication is to start with the 3.75/23 milligram dose and stay on that for 14 days. If you do not notice any side effects in these 14 days, then you can increase to the 7.5/46 milligram dose. From here, you continue this dose for 12 weeks, and if you notice consistent weight loss, you just stay at this dosage. If you notice not much weight loss, anything less than 3% of your body weight, then you can increase up to the 11.25/69 dose for another 14 days. And if there's no side effects, then you can increase to the maximum dose of 15 milligrams/92 milligram and continue this dose ongoing. So what are the key side effects to be aware of? Due to Qsymia being a combination of 2 different medications, it can often have more side effects than other weight loss medications that only have one mode of action. There is a long list of potential side effects, but the top 5 most common side effects of Qsymia are paresthesia, which is the medical term for tingling sensation, dry mouth, constipation, upper respiratory tract infections, and headache. There is increased side effects as you increase the dose. Therefore, it's recommended to use the lowest effective dose to minimize side effects. So how much weight loss should you expect with Qsymia? 2 studies were done to investigate the efficacy of different doses of Qsymia over 56 weeks. In addition to Qsymia, all patients were given dietary and exercise advice. The results of study 1 are shown here. As you can see, patients that took placebo, a pill that has no active treatment, had an average weight loss of 1.6%. Patients that took the 3.75/23 milligram dose lost on average 5.1% of their body weight, and patients that took the 15 milligram/92 milligram dose lost on average 10.9% of their body weight after 56 weeks. This is the results of the second study that shows similar results, with the average weight loss of placebo being negative 1.2%. The 7.5/46 milligram dose, the average weight loss was 7.8%, and with the 15 milligram/92 milligram dose, an average weight loss of 9.8% after 56 weeks. This is a graph illustrating the weight loss over the 56 weeks of both of the studies. As you can see, most of the weight loss occurs by 40 weeks in study 1 and 32 weeks in study 2, and then the weight loss plateaus for the remainder of the study. What you might have noticed is that the graph seems to suggest that the average weight loss is more than 12% for the 15/92 milligram dose, which is higher than what was shown in the previous slides. The reason for this is that this figure is only counting the people that did not drop out before the 56 weeks. Dropout rates from both studies before 56 weeks was reasonably high. 40% of patients in study 1 and 31% of patients in study 2 did not reach 56 weeks. If you include the result of the patients that dropped out, then this will bring the average weight loss down and you will get the results in the previous 2 slides, and this is also represented in the blue column at the end of the graph. This is typically considered in research a better way to display results, known as intention to treat. If you remove the patients that drop out and do not apply intention to treat principles, this may bias the result against the population of the patients that dropped out, as they may inherently be different to the patients that stayed in the study. However, you may infer that if you are one of those people that can take the medication for 56 weeks, you may experience an average weight loss closer to 12%. So how does this compare to other popular weight loss medications such as Ozempic? Ozempic is a diabetic injectable drug that has the active ingredient semaglutide. Given Ozempic was originally designed for diabetics, all the studies of Ozempic are in diabetic patients only. One example of a study of Ozempic is a 40-week trial of 961 patients with diabetes in combination with 2 other diabetic medications, metformin and sulfonylureas. This was the results of the study for weight loss. The 1 milligram dose after 40 weeks had an average weight loss of negative 5.68%, while the 2 milligram dose had an average weight loss of negative 6.4%. This appears to be less than Qsymia, but this study did not recommend daily exercise and dietary advice in conjunction with Ozempic, and the results were only after 40 weeks. Wegovy, which is the brand name of the weight loss version of Ozempic, which has the same active ingredient semaglutide, was studied in the same population as Qsymia, patients with obesity, and patients were also given the same dietary and exercise advice as Qsymia. For Wegovy, 2 key studies were done. The first went for 68 weeks with 1,961 adults. Patients were given Wegovy 2.4 mg, which is semaglutide 2.4 mg, and the average weight loss after 68 weeks was negative 14.9%. Another study enrolled 304 adults and went for 104 weeks, and the average weight loss at the end was 15.2%. This is a graphical representation of the weight loss over the duration of the second study that shows that weight loss continues to occur until roughly the 1-year mark, where weight loss plateaus but is maintained. These studies suggest that taking semaglutide at the higher dose of 2.4 mg is probably more effective for weight loss than Qsymia. However, one thing to note is that Qsymia at its max dose is Phentermine 15 mg and Topiramate at 92 mg. You can actually be prescribed components separately at higher doses. Phentermine on its own typically comes in 15, 30 and 40 mg dosages, while Topiramate on its own can go up to 200 mg. If you use 40 mg Phentermine in conjunction with Topiramate 200 mg, this is more than double the dose of Qsymia, which is likely to give you more beneficial results for weight loss, potentially rivaling the results seen in Wegovy and possibly even exceeding it. The main issue is that the side effect profile of Qsymia is already quite high, so if you're using even higher doses, this may exclude many patients from being able to get to this dose due to inability to tolerate the side effects. So that's my concise review of Qsymia. If you found it helpful, don't forget to like and subscribe to the channel. It will really help me out a lot. If you're interested in learning about another weight loss medication that may be more effective than all the medications mentioned in this video, check out this video here on Zepbound, and I'll see you in the next video.